speed, everyday juggles. On my way back into Mexico, I just crossed the border. I had a discussion this morning with Hal Gill on his Hair Wings podcast, and I've been thinking about it the whole time that I've been out to the U.S. today, and I had to follow up, and I was going to write this long-winded sort of technical piece that no one would ever read in a million years. Instead, I decided it would probably be a better idea just to actually record a podcast, the same long-winded technical material that no one will ever watch. So basically, in any case, so what I was thinking about, so at the end of the discussion, it might say it was about the end, but at the end of the discussion with Hal, we were talking about AlphaFold and the idea of good computers. So okay, but give the context of this. I gotta step back and say the context of this is the administration moves or the general moves to move out of animal testing and into AI for computer modeling of these sorts of things, of basic drug interactions, drug testing. And kind of a general sense, that's a really great idea. And I think everyone is supportive of that. And most people obviously don't want to use do animal testing for many reasons, ethical reasons and others. And so the idea is of animal testing. They say we don't need this anymore because now we have computers. They are so powerful, the modern AI, the modern computing, that we don't need animal testing. We can model all this stuff in the computer, and just like that, we're done with animal testing. So in theory, it sounds good. It sounds really good. The problem is it can't be done, at least not right now, and maybe perhaps not for a very long time. And now Hal's point was, and many have made this point, that well, they said the same thing about protein folding, and Google's AlphaFold project, demonstrated that could be done. The thing you have to understand is there's a major difference. There's many major differences between protein folding and drug interactions on a human body scale. So basically all computer programs are composed of rules. Anything, really any process, anything in the world that can be described by a set of rules could theoretically be just abstracted into mathematical formula, which could theoretically be programmed into a computer, which could theoretically be then used to solve those formulas. So anything, I mean anything, absolutely anything. The rules are that's because of interaction, hydrogen bonding, the van der Waals forces, the electrostatic interactions, all those things that go into chemical bonding. All of those rules are known, and they're well known, and they've been known for a very long time. The challenge was abstracting those rules into mathematical formula, which could then be translated into computer programs, computer software, which could then run and solve those equations. Okay, it was incredibly complex, incredibly challenging, but ultimately everybody knew it was doable because those rules are so well known. The laws basically of chemistry, the rules of how molecular interactions occur, and at the molecular level in chemistry. So in biology now biology is partly chemistry. So I'm not saying that's not part of it, but it's much more complex than that. So in order to use a computer to solve all of the, let's say to formalize, so you would have to formalize all of the rules basically that describe how life works for every organ system in the human body in order to have a program that could actually do this successfully. That would mean you would have to know the structure and function of every single receptor on every single cell in every single organ system throughout the human body. We're not even close to having that level of knowledge. No, we're nowhere near having that level of knowledge. Even for some organ systems, we're maybe close or closer, but we're not all the way there. And then, that's one part of the challenge, which is hugely challenging. It's not a computer. It's not that computers can't do this. Absolutely, they can. It's that we don't have the knowledge yet to program the computers to do it. Okay, because we don't know what the rules are because we don't have all the information to set the rules. Now, we may get there someday. We may have all the information in order to describe all of the rules. Once that's done, we can put them in a computer, and the computer will, for sure, be able to solve the problem, given enough time and enough processing power. That's what computers do. That's how they work. That's what they're good at. That's why we invented them, to solve problems, to solve mathematical problems. Now, there are some people that say the entire universe can be described by rules and mathematical formula. And this is a philosophical position that many have held. So these are my favorite philosophers, Wittgenstein being one, but others have said, the whole universe basically, they just explicitly say this, but sort of implied the whole universe could be abstracted to a series of rules. Certainly that's true of certain parts of the universe, for instance, games. That's the definition of a game. It's a series of rules. That's how a game works. If it doesn't have a series of rules, it's not a game, but something else. So whenever someone is surprised that computers can be humans or other rules, anything that's a series of rules, a computer will always beat a human at because a computer is faster at following rules. It's faster at solving problems, especially mathematical problems, or all mathematical and statistical problems. So there should be no surprise ever when a computer beats a human at any game. That includes physical games eventually. Right now, the games that require a body, a computer cannot beat us at. But once we have embodied computers, they will also be able to beat us at all of those games. because not only will they have superior computing power, I mean, superior mental capacity, if you want to call it that, but also superior physical capabilities. So there should be no surprise to that. And no one should be like, oh, wow, that's amazing. Every time I can remember when first computer beat a human chess, and was like, oh, wow, that's amazing. And I had to laugh at that because it's not amazing at all. It was known. It absolutely was going to happen. It was only a matter of when. And it's the same thing with Go or any other game out there. Sorry, Risk, Monopoly. It doesn't matter what it is. Even if it's based on luck or chance or probability, the computer will still always in the end win because the computer is better at those things. It's better at math, including random, probabilistic, chaotic, those kinds of mathematics. Any of those things it's better at than a human and always will be. Again, by design, by invention. That's why we invented them to do these things that humans were not capable of doing. Well, let's not say not capable, could not do as quickly or as efficiently as a computer can. So, back to the problem at hand. Went way off on a tangent as I normally do, but back to the problem at hand as far as using computers and AI, modern computing to model drug interactions at a whole body level. It's just not possible right now because we don't have the knowledge. Not that the computers aren't powerful enough. Maybe they are, maybe they aren't. But the knowledge gaps are too large in terms of what the rules are that we need to program into the computer in order to do this kind of modeling. Sorry, I lost my train of thought there. It's a little off on a rant as I usually do. You know, it's something that's still there too. Sorry, I had something else I wanted to say. Now I got all excited, worked up about it. Now I can't remember what else I was going to say. I'm sure it was all inspiring and intellectually confounding as well, especially to me and you, the one person that's listening, whoever you are. Thanks for listening, humoring me. I can't promise you'll learn something. What that will be, I don't know. But it's nice. Yeah. What you will not learn is Spanish. That's for damn sure. Because my Spanish sucks. As you get to tell that sad demonstration right there at the toll. You'd think I would learn Spanish by now, but I'm not even anywhere near close to competent at no level. I just am not talented in the language learning uh, arena, which is strange because I'm talented in every other arena. Yeah. I keep joking. When I say those things, I'm joking. I say things like that a lot. I think I'm serious. And then I have to stop and say, no, I'm not serious. I'm not really good at everything. Just most things. Just almost everything. Close to everything. Except for language. I'm no good at that, as I already said. I already admitted to that. So there you go. See, I'm not good at everything. Just almost everything. 90%, 95%. Well, let's say 99% for all companies, if not. Well, maybe 99.9% is closer, but almost everything, but definitely not language learning. And again, I'm joking. I hope people understand. I hope they understand that. But when I say shit like that, I'm just joking. It's all right for the swearing there. Try not to swear as much. My dad actually lectured me a little bit via text message about my swearing. Well, my use of the F word way too often, the F bomb, which I drop all the time. But in spoken language, in speaking with people, I rarely use that word. I rarely swear. In fact, and it's because of the example of my parents. My dad in particular, very strict on the profanity front. They do not use it, and I understand why. It's stupid. But at the same time, sometimes it's kind of fun. And when I write, I drop F bombs left and right, which I'm trying to do less of. Thanks to my dad, which I appreciate that, Dad, the advice. I mean, you're right. It sounds eventually you end up to sound stupid. Why does dumbass swearing all the time? It doesn't, it's not really anything. It's just kind of dumb. So in any event, I'm trying not to swear as much, and I don't really swear all that much in spoken, spoken things. If you listen to any of my other podcasts, and I'm sure you don't, I'm sure you haven't, unless you're that one person that has, and I doubt that you are, unless you are that only one. If you are, then yeah, you've heard, you know for sure that I don't swear very often when I'm talking. However, my written word, I swear quite a lot. And I don't know why that is. I think mostly it's because when I write stuff, I typically it's not me. It's a version of me. It's parts of me, but it's not really me. Whereas when I'm doing the podcast stuff or the talking, kind of on camera, if you will, it's more me-ish. If that makes any sense. It's still not me 100%. It's probably 90%, maybe 95. I don't know, maybe 80%. It depends. It varies. It's pretty chaotic. It's quantum fluctuations, probabilities, all that whatnot. Yeah, I know. It's so great. You know, when I start talking to myself like that, and that's how my head, it's what goes on in my head all the time. And it's just, I'm like, man, you're crazy. There's something wrong with you. Then I think to myself, you know what? Every other person on the planet thinks the exact same way. I think. Most of them. Otherwise, I am crazy. I doubt it. Dude, what are the chances that I'm crazy and everyone else is perfectly sane? I think that's pretty low, right? The probability that's almost zero. Chances are much greater that I'm just sane when everyone else is crazy. So at least I would say that. Of course, I would say that's me. Man, take a breath, slow down, damn. Yeah, I cracked myself up. Anyways, what was I talking about? Oh yeah, the human body, the bodily and drug interactions and all that whatnot. Yeah, so it's not going to happen basically anytime soon. If you listen to the CEOs of the major pharmaceutical companies and such, and no one does, so that's okay. But if you do, you can listen to them. They will say just as much. Now they're not going to say it in public in real loud, real loud terms because of what the administration stands on this, the politics of it. Of course, they're going to say, "Oh, it's possible. Yeah, we can do it," but they can't. They're lying if they say that, and they don't really say they don't want to lie. Generally, I mean, they are CEOs, so they can do that from time to time. But generally speaking, they try not to just flat out outright lie. So they're gonna kind of suggest that, oh yeah, we can do that, we can, but yeah, they really can't. Oh, I remember what I wanted to say earlier. The upshot of this whole thing is that with the remove away from animal testing, which is again is a good thing in theory, and I'm all very supportive of it. What they've basically done here is they've not moved away from animal testing; they've moved into human testing. So they pushed the animal model testing, which previously would have happened, now into clinical trials, into the clinical trial stage. So what's going to happen is you're going to have more people getting sick and dying in clinical trials. So it's sort of a balance of are you in favor of more animals dying, suffering and dying, or of more people or less people suffering and dying? I guess maybe is the way to put it. I don't even know. It could be the same number of people as animals that would die, or it could be less. It definitely will be less because with animal studies, even if the animals are not impacted by in the trial, I believe they are all euthanized in the end typically. Whereas with humans, if you participate in a clinical trial and that drug doesn't work, you're not euthanized. Or even if it does, you're not euthanized in the end. So there is that. You definitely will have a greater survival rate, I'm sure, unless the drug kills it as 100% lethal. At which point, then you won't have that. And I'm sure they'll write these contracts, the clinical trial waivers that you sign, such that they cover all those potential possibilities. So you might be cured, or you might die, but either way, the pharmaceutical company is what they want, which is the data to help them either sell the drug or go run and hide and cry themselves to sleep at night. But I don't know. They don't do that. I'm sure they don't do that. They live in their mansions and their luxury homes and whatnot on the ocean. Oh yeah, that's where I live too. But it's no, it is a mansion. And it is a luxury home, actually. I live in a mansion on a luxury home on the beach. Well, son of a bitch. I guess that's a good thing about living in Mexico. It's because I'm not rich, man. I can tell you that much. I'm poor as they come, dude. I got no money. I really have got no money. I really could use some paid subscribers. So if you're listening to this, you're not a paid subscriber, go ahead and subscribe. I'm charging the lowest rate. I'm only trying. So this is another interesting thing. Substack. So Substack only will let you charge. There's a price. They put a price floor on what you can charge for a yearly subscription. So the lowest price they would let me charge is $30 a year for this subscription thing. Which, just by the way, you get nothing extra with a paid subscription to the Everyday Juggler. So intelligent nonsense, I should say. There's no extra bonus that you get for being a paid subscriber. Other than it's a huge bonus for me because I feel really, really happy about it, and I really need the money. So it is a kind of that kind of sort of bonus in that way. If that makes you happy in any way, which it probably wouldn't. I'm not sure why it would, but if it does, great. Because please, I could really use the money, and I really do put a lot of effort, time, and stuff into this work I do. Which some people say it's not work, but I think it is work, even though I really love it. But I won't do anything I don't love, which is kind of annoying to many people. But it's just the way it is. I just can't do something I hate. I really just can't do it. I lose focus too easily. If I don't like what I'm doing, then I'm just like, I'm not doing this, and I just walk away. That's not very good in terms of long-term stability, typically, when it comes to like jobs and such. However, somehow I've made it work. Most because I've always found jobs that I really love to do, which I guess maybe I'm pretty easy to please, or maybe I'm just stupid. I don't know. Anyhow, I'm home now. So, in my luxury mansion, which I can't afford, but in Mexico I can, which is great. So I highly encourage you to move to Mexico, even though you really shouldn't. Although, and you can see this property right next door to mine is for sale. And it would be nice to have some cool neighbors for once, because I don't really know many of the neighbors here because everyone's all secretive and quiet for reasons, well, for the reasons you can probably imagine. Anyhow, I'm done going off, and thanks for listening, whoever did join, and appreciate it. And I'll be doing another one of these, I'm sure, at some point in the future that will have just as much interest, I'm sure, if not more. Thanks, everybody. Later.